legislative proposal aimed at addressing a serious shortage of home health care workers is one step closer to reality.
Maine's workforce crisis is taking a toll on families of children with the highest medical needs who often step in to provide round-the-clock care themselves.
Yeah, the bill headed to a vote in both the Maine House and Senate would pay parents to be their kids' caregivers. News Center Maine's Vivian Lee has our follow-up.
In April, we introduced you to 7-year-old James Dole, his 5-year-old brother Rafe, and his mom, Andrea.
You having fun, sweetie?
James, who loves to swing, needs constant medical care and therapy. Born with microcephaly and cerebral palsy, he is also nonverbal and has a feeding tube. The youngster has a nurse, Richard, who is by his side at school, but it's not enough to cover the hours of care he needs and qualifies for. Over the past 5 years, 17 nurses have left for better paying jobs. With most of her son's care solely on her shoulders, Andrea, a licensed social worker, is unable to work. Under MaineCare rules, the state's version of Medicaid, she also can't get paid to be James's caregiver. But that could change under a proposed bill.
That would be such a huge relief to know that there's actually compensation coming in.
LD 346 would extend MaineCare coverage to parent caregivers. Nancy Cronin is the executive director of the Maine Developmental Disabilities Council.
Parents will have to apply to work for a home health care agency because you need a fiscal intermediary. And this is a good thing.
The bill, which still faces votes in both houses of the legislature, will require DHHS rulemaking and a state plan amendment. If approved, the program could be in place in July of next year.
It's going to be less of a burden for the taxpayers, and the home health industry will be getting more very skilled workers, so it feels like a win-win for everyone. The children are going to come out on top.
James, who was recently hospitalized with pneumonia, was able to recover and competed in the Special Olympics last month with his family and community cheering him on.
He was taking all the steps, with the support of the gate trainer, and it was a blisteringly hot day.
The bill could impact as many as 100 families across the state. Compensation, Andrea believes, is critical to help parents and their children survive emotionally and financially. Vivian Lee, News Center, Maine.
The Home Care Alliance of Maine, which represents home health care providers across the state, supports the bill. If passed, providers will support parents with training and oversight.